Good morning. I'd like to thank you all for being here today, and particularly thank our DEA Administrator, Mr. Rob Patterson, for his leadership on the issue before us today. DEA plays a vital role in our efforts to reduce opioid threats in America, really the centerpiece of the government's efforts in that regard. Today, we are facing the deadliest drug crisis in American history. We've never, ever seen the death rates that we're having today. 64,000 died last year. Based on our data, the overdose rate continues upward. It would be the highest drug overdose death toll and the fastest increase in that death toll in American history. For Americans under the age of 50, drug overdoses are now the leading cause of death. This crisis is driven primarily by opioids, prescription pain medications, heroin, and synthetic drugs like fentanyl. Fortunately, President Trump has understood the gravity of the situation and has a great passion for this issue. He's taken rare steps on declaring a public health emergency and requested more than $1 billion in anti-opioid efforts in this new budget. And has indicated if we need more and we can do it effectively, he would consider more. So I want to thank Kellyanne Conway, where Kellyanne is over here, for being here today. The president has made this a White House priority. He's asked her to coordinate and lead the effort from the White House. She is exceedingly talented. She understands messaging, and we've got to change the perception in this country and try to reduce through prevention addiction in that regard. She is exceedingly talented in that, has total access to the president, and I think her appointment represents a very significant commitment from the president himself and his White House team. The day I was sworn in as Attorney General, the president sent me an executive order to go after transnational criminal organizations, including the cartels who exploit the vulnerable and profit off addiction. I'm convinced that our law enforcement efforts save lives because they prevent new addictions from starting. By enforcing our laws, we keep illegal drugs out of the country, reduce their availability, drive up their price, and reduce their purity. Those are all tests of how well law enforcement has been working, and over the last several years, the trends have been very bad indeed in each of those categories. The Department of Justice has taken a number of steps this year to make our efforts more effective. In this year's 2 drug take-back days that DEA organizes and leads, we took more than 900 tons of unused prescription drugs off our streets, 900 tons, before they could fall into the wrong hands. In July, the department announced the largest healthcare fraud takedown in history. It coordinated efforts of more than 1,000 state and federal law enforcement agents to arrest and charge more than 120 defendants for opioid-related crimes. Many of these, unfortunately, were professionals, doctors, pharmacists, and others. In August, I announced a new data analytics program called Opioid Fraud and Abuse Detection Unit. We believe it will be very effective. It will help us find the telltale signs of opioid-related healthcare fraud. It will identify the outliers where extraordinary amounts of drugs may be moving through a physician or through a pharmacist. I've also assigned experienced prosecutors in the 12 opioid hotspots across America to focus solely on prosecuting opioid-related health care and fraud. Armed with better data, these prosecutors have already begun to return indictments. Additionally, the department has indicted 2 Chinese nationals for separate schemes to distribute massive quantities of fentanyl, the number 1 killer in America today. The truth is clear. Most fentanyl enters the United States from China. There is no doubt about that. I've raised it with a recent Chinese delegation. Deputy Attorney General Rod Rosenstein, in a recent visit to China, made it an important issue with them, and the recent trip by President Trump to China involved his personal raising of this issue and strongly emphasizing it to our Chinese neighbors. So we're going to need more support from China. Hopefully we will get that. Earlier this month, DEA announced its intent to issue emergency restrictions on all forms of illicit fentanyl, which will make it harder for criminals to circumvent the law and easier for prosecutors to prosecute. As deadly as fentanyl is, you can go online and order it too often through the mail. That's why in July, the department announced the seizure of the largest dark net marketplace in history. The site hosted some 200,000 drug listings. In other words, any individuals who could access that site in the United States have got 200,000 choices of suppliers to buy drugs from that could be sent through the mail. The site hosted a large number of purely fentanyl distributors. And it resulted in deaths. So we know of a teenager who ordered drugs offline, not knowing what they were. Perhaps it was fentanyl, and distributed it to a 13-year-old who overdosed and died. So these steps are important, and I believe they have saved lives already, but there is much more to do, and we will do more. Today I'm announcing 3 initiatives to turn the tide. First, the department will continue to back the blue. I'm announcing more than $12 million in grants to state and local law enforcement agencies across America to take heroin, methamphetamines, cocaine, and other illicit drugs off the market. Second, I'm announcing a restructuring at the DEA with the establishment of the first new field division in 20 years. The current Louisville district will now be the 22nd DEA field division with about 90 special agents and 130 task force officers. This field division will cover key areas: West Virginia, Kentucky, and Tennessee. These areas covered face similar drug threats, enabling this division to better focus on the particular threats of that region. They will be led by Special Agent in Charge Christopher Evans, who served DEA for more than 25 years. Third, and finally, I'm ordering all our U.S. attorneys' offices to designate an opioid coordinator to serve as a kind of quarterback of our anti-opioid efforts in that community. They will convene a task force of state, federal, and local law enforcement to help determine which cases to take to federal court, which ones can be better in state court. They will help customize and evaluate the effectiveness of every United States Attorney's Office's strategy to combat the opioid epidemic. A strategy based on local conditions on the ground, and that's important because conditions are different in every area. I believe that these changes will make law enforcement more effective and the American people safer. But our work is not finished. We will not slow down for one day or even for one instant, with one American dying of a drug overdose every 9 minutes. Our laws are more important than ever. We will not cede one city, one neighborhood, or one street corner to gangs, violence, or drugs. We need to use every lawful tool we have, and we will. The department will continue to take whatever steps we deem appropriate and effective toward the goal of turning this deadly tide. I know that this crisis is daunting. The death rates are stunning, and it can be discouraging. But we can and we will turn the tide. When the men and women of law enforcement work effectively in a focused way, targeting the most serious criminals, we can stop the growth of destructive addiction, keep American people safe, and save lives. Thank you. I'll now turn to Rob, who's had great experience in the DEA, to discuss their recent efforts in more detail. Rob.
Thank you, sir. Thank you, and also thank you to the Attorney General for the support that he provides DEA every day by his actions. Good morning. Over the last 15 years, our nation has been increasingly devastated by opioid abuse. It is an insidious epidemic created in large part by the overprescribing of potent opioids. This has resulted in the new generation of opioid abusers, presently estimated at 12 million Americans. More recently, we've seen a downturn in the overall number of opioid prescriptions, but there remains more work to be done, although that is a positive step. DEA's Diversion Control Division has a central role in addressing this problem. DEA uses all available means, administrative, civil, and criminal, to ensure that its 1.7 million registrants handling prescription drugs comply with the law. We will continue to use these tools to protect the public from the very small percentage of registrants who exploit the system or their customers for profit. Over the last decade, DEA has levied fines totaling nearly $390 million against opioid distributors nationwide. We have also entered into memorandums of agreement establishing additional compliance measures to ensure that they are both detecting and reporting suspicious orders. Those same distributors and some manufacturers are now also the subject of investigations into potential violations of state law. In November, DEA met with representatives from 44 states, including members of a coalition consisting of 41 states' attorneys general. At that meeting, we made a commitment to work collaboratively with all states by sharing information to support ongoing investigations and providing additional intelligence to generate new cases across the country. I am confident this cooperative effort will be a productive step in ensuring compliance by the pharmaceutical industry. Since 2010, DEA has augmented many of its criminal investigative groups with tactical diversion squads. We currently have 77 diversion squads nationwide that are solely dedicated to investigating those involved in the diversion of controlled substances. In addition, we recently deployed a mobile tactical diversion squad to West Virginia to provide support in a region hit hard by the opioid epidemic, and are working to deploy additional resources in other similar hotspots around this country. While DEA's diversion control program seeks to limit the diversion of prescription opioids from the drug supply chain, DEA continues to attack the illicit supply of opioids, specifically heroin and fentanyl-related substances just mentioned by the Attorney General. In this vein, we recently announced various investigative efforts attacking criminal groups located in China, Mexico, and on the dark web. These cases are good examples of our efforts to prioritize resources in attacking the illicit opioid trade. Through the use of DEA's emergency scheduling authority, we have aggressively sought to place temporary Schedule I controls on fentanyl-related substances. In addition to the 16 fentanyl analogs that we have already sought to control, we've notified our Health and Human Service colleagues of our intent to place emergency Schedule I controls on the entire class of fentanyl-related substances. This scheduling action is critical, again, as the Attorney General just mentioned, because our investigations reveal efforts by some traffickers to change the molecular structure of fentanyl in an attempt to thwart law enforcement and evade prosecution in the United States. Lastly, DEA has made a concerted effort to evaluate our deployment of resources in the attempt to maximize effectiveness. Last month, DEA established 6 new heroin enforcement teams strategically placed in communities facing significant challenges with heroin and fentanyl-related substances. These teams, located in Massachusetts, West Virginia, North Carolina, New York, and 2 groups of Ohio, are dedicated to this cause. In addition, today, again, as just announced, DEA is pleased to announce the creation of the Louisville Division. This new division encompasses the 3 states, Tennessee, Kentucky, and West Virginia, and establishing this division in the region helps synchronize our efforts with law enforcement partners and allows for closer coordination with the various prosecutors' offices in the area. These 3 states combined are problematic in the Appalachian region and very specific to the opioid crisis. The dedicated men and women of DEA in communities across the United States and countries all over the globe will continue to fight hard to keep these destructive drugs off our streets and make our communities safer. We also recognize that this is a larger issue than law enforcement efforts alone. This is a complex problem which requires the cooperative efforts of others in the medical community, the pharmaceutical industry, lawmakers, educations, and families. DEA will continue its efforts in addressing the opioid epidemic, working with others, and leveraging every available resource to attack the problem. Thank you.
Okay, we'll take a few questions. Laura?
Mr. Attorney General, as you think through ways to combat all drugs, have you given any further thought to federal treatment of marijuana and whether you want to keep the Cole memo in place and any other updates you want to make?
In fact, we're looking at that very hard right now. We had meetings yesterday and talked about it some length. It's my view that the use of marijuana is detrimental, and we should not give encouragement in any way to it, and it represents a federal violation, which is in the law, and it's subject to being enforced, and our priorities will have to be focused on all the things and challenges we face. We've got fentanyl, heroin, cocaine, methamphetamine, prescription drugs, and marijuana and other drugs. So we'll be working our way through to a rational policy, but I don't want to suggest in any way that this department believes that marijuana is harmless and people should not avoid it.
Ongoing debate about sanctuary cities will not affect how funding is dispensed. And then secondly, in the ongoing election down in mentioned that he was voted by absentee. How do you plan to vote, if you could give us a sense, and what is your recommendation to the people of Alabama?
Well, with regard to the sanctuary cities, we have information from people in states from around here. In fact, Kellyanne Conway and I were just talking about it. They believe sanctuary cities are creating sanctuaries for drug dealers and cartels who are moving drugs here, and they're feeling it even across state lines. So I think sanctuary cities are a detriment to enforcing our drug laws, and it just reaffirms my view that this is a very, very bad policy, and we have to urge our cities and counties that are thinking this way to reevaluate. When someone is here distributing drugs, they're unlawfully in the United States, and they're apprehended. I can't imagine why a jurisdiction would not want to bring their case, state and local case, and then see that individual deported. It's already unlawfully here. They commit an additional crime. So I feel strongly about that. According to the Attorney General's guidelines and ethics, I have not taken sides in that race. There've been some ads suggesting I may have endorsed a candidate. That is not so. I believe that the people of Alabama will make their own decision.
Mr. Attorney General, your Civil Rights Department, for the most part, has not done many investigations into systemic racial discrimination, but you are currently investigating. This is the Attorney General of the United States. I understand you're doing your job, but I'm doing mine too. Your Civil Rights Division is investigating Harvard University for possible civil rights violations related to affirmative action, possibly discriminating against Asian Americans and white students. Why is this a priority for your Justice Department?
Okay, we'll take an on-topic question on opioids.
Why can't he answer that, though? I mean,
This is a conversation about our opioid policies.
he was able to ask about Alabama. He was able to ask about sanctuary cities. Why
Yes,
can't I ask you about this?
Sorry. Attorney General Sessions, recently you announced the decision that you're going to try to do an emergency schedule for all fentanyl analogs, but this has been an ongoing problem for several years now, obviously. Why are you only just taking this step now, and how are you going to define it to ensure that all of the possible analogs that are out there are actually captured in this order?
We've essentially accomplished that. It's been pretty complicated. Maybe Rob would like to share. DEA does this. They have the authority and responsibility to provide the regulations in this regard. Rob, you want to share any thoughts?
So it's a relatively long answer, and it may be something better for later in terms of how this would get done. What it takes is all analogs outside fentanyl is Schedule 2, as well as carfentanil for legitimate medical uses. These are fentanyl analogs that would be scheduled all under Class 1. We have not seen any of those fentanyl analogs used for research in corporations and other places. It's an aggressive use of the scheduling. but we think that it's warranted at this point, mainly because we see an increasing amount of, like I said, chemical, or I shouldn't say chemical, but changes to the analog that we know are resulting in death around this country.
Why are you doing it now? But why wasn't this done like several years ago?
I think this is a change in administrations, and I think this is the way to look at being aggressive with the tools that we have.
I'll take a walk now.
The Washington Post has reported extensively on this 2016 law that I think gently put, sort of strips the DEA of a tool it has to stem the flow of pain pills from pharmaceutical companies to the black market. And recently, 44 state attorneys general said they want that law repealed. What is your view on that? Should that law be repealed, and will you lobby your former colleagues in Congress to repeal that law?
I was dubious about the law when it passed. Maybe the last person that went along with it after the Department and DEA agreed to accept it. We think we do need legislation. We can listen to the concerns that certain people had and draft good legislation, but I would be supportive of new legislation to be able to have a full toolbox in dealing with the problem of improper sale policies. I guess you would describe it that way. We're still working those cases. DEA is very aggressive on them, but I guess you would say, Rob, that there are in some areas it's more difficult than it would have been had that law not passed.
Do you support then repealing it and replacing that law?
I will support legislation to make sure we're fully able to carry out effective enforcement policies.
Brad, did you have anything on that, or you good? No. All right, thank you.
All right, thank you.